Good morning. It's great to see so many participants joining us today virtually. I'm so excited that we are gathering today for what will be a very important conversation. My name is Isabel Becerra, and I am the President and CEO of the Coalition of Orange County Community Health Centers. Welcome to the Coalition's Coffee Connections event. We are so excited to kick off the first quarter of 2023 with our Coffee Connections event focused on empowering communities through advocacy to create a healthier Orange County. As many of you know, the Coalition of Orange County Community Health Centers is a membership organization that represents the interests of the health centers that serve our community's most vulnerable patients, those who are either uninsured or underinsured and face disproportionate risks due to structural racism and discrimination, and who our public health system too often overlooks. Our membership includes 27 community health centers, collectively operating over 70 sites throughout the county and serving over 350,000 patients with over 1 million visits per year. Our members, many of whom are joining us virtually today, provide quality preventive and primary care, oral health, mental and behavioral health, program eligibility, health screenings, food and rental assistance, and more. For over 49 years, the Coalition as an organization has engaged in the work of building a healthier Orange County. We believe that for our community to thrive, everyone must have equitable access to quality, affordable health care, regardless of income, ethnicity, or immigration status. We are an experienced team of public health professionals and advocates and experts in health center operations, policy, quality improvement, and practice transformation. We ensure our member health centers have a voice at the table when policymakers and leaders from the healthcare community are making decisions that will impact their delivery of care and ability to serve the needs of patients in Orange County. We have the funding and the resources needed to provide the high quality and value-based care. And we have the latest policies and regulations, promising practices, research, and innovations. Raising awareness, providing education and training, and facilitating thoughtful and often uncomfortable conversations to enable change is integral to the work of the Coalition. With that in mind, our team has put in place the Coffee Connection events, which are designed to unite and connect, educate, and drive action of the health center workforce, partners, Coalition staff, policymakers, and other stakeholders on key healthcare and public health topics and issues impacting the Orange County communities. Through these events, we strive to create a platform in which we have shared understanding and common language, as well as a space for continued collaboration to further drive actions towards a healthier Orange County. Today's event will focus on a critical topic that we feel cuts across everything we do in medicine, healthcare, and community and public health: advocacy and civic engagement. The framework of advocacy serves as a tool to allow providers, public health professionals, legislators, patients, and others to bridge the gaps within our healthcare system to ensure that individuals, populations, communities can access affordable and high-quality healthcare and live healthy lives. These gaps are measured by differences in prevalence, mortality, and other adverse health conditions among specific groups based on factors like gender, socioeconomic status, or race. Advocacy also allows us to influence health policy and create system-level change. As we think about advocacy, we also think about partnerships and the importance of building presence, especially with members of the community, from residents to key stakeholders, in which we are trying to create change. More specifically, this event is focused on creating a common and shared understanding of advocacy and civic engagement. Through our presenters, this session will provide us with concepts and tools to help strengthen our organization's advocacy and civic engagement mindset, and examples of how to integrate the framework into our organization's culture. As we think about health equity, we think about how we can attain the highest level of health for all people in a way that values everyone equally and focuses on ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. With that in mind, an integral part of today's session is our coffee chat with leaders who represent both community-based organizations and legislators. Through intentional conversation, This session will provide us with actionable steps, insights, and tips on how to build presence with our legislators and policymakers as we collectively advocate and work toward addressing the structural determinants of health. For example, the governing process, economic and social policies, housing, education, working conditions, etc., that serve as the root causes of health inequities and ultimately shape the quality of the social determinants, which are the circumstances in which people are born, grow, live, learn, and work in. And before I hand the mic over to our keynote speaker, I want to leave you all with my why, in hopes that as you listen to today's session, you too will keep your why at the forefront. My journey in community health center movement started over 26 years ago. From Maryland, Seattle, and on to California, I witnessed the barriers to health for the underserved, and it led me to return to my roots in Santa Ana and to the Coalition, determined to dedicate my career tackling these barriers head on. I have since been with the Coalition for 23 years, and every day I am reminded of the quote by Margaret Mead, who said, "Never doubt that a small group of thoughtful, committed citizens can change the world." I am an advocate because I believe every action and every voice counts. Health starts long before illness in our homes, schools, and jobs. As such, all individuals should have the opportunity to make the choices that allow them to live a long, healthy life, regardless of their income, education, or ethnic background. We feel today's session will provide us with the platform to speak the same language and equip us with key actions and tools needed to advocate for a healthier Orange County. With that, it is my pleasure to introduce you to Orange County's 2nd District Supervisor, Vicente Sarmiento, who I'm honored to say will be providing us with our opening remarks. Supervisor Sarmiento's election to the OC Board of Supervisors in November of 2022 is historic and strengthens hope for systemic change for the vulnerable communities we represent and for whom we are leading towards equitable access to high-quality health care. Let us welcome Orange County Supervisor, the Honorable Vicente Sarmiento. Welcome, Supervisor Sarmiento. The microphone is yours.
Hello, can you all hear me? Great. For whatever reason, I'm not getting any audio on this side, but I'll just assume that you all can hear me. It's great to be with you all. Thank you so much for the invitation to come and speak with you for a few minutes and at least join you virtually. I know a lot of familiar names and faces on the screen. So for those of you who I don't know, it's great to be with you all with the Coalition of Orange County Community Health Centers and on this topic of empowering communities through advocacy to create a healthier county. I'm Vicente Sarmiento. I'm the new supervisor here for District 2. I am, I think, a little over 90 days on the job, so I'm still learning a lot. I'm absorbing as much as I can, but for those of you who don't know my past, I am the former mayor of the city of Santa Ana and was a council member before then. I arrived as a council member in 2007, and then became mayor in 2020. So my career was bookended by a couple of significant moments. In 2008, you all remember the Great Recession, and then 2020 comes around when I become mayor, and we have the global pandemic. So we, my career has been bookended by a couple of significant moments that have really shaped my way of governing. But one of the things I can tell you is that your topic is so important to me that we align on many items, and just empowering communities, especially the community that I represented and the city I represented, and really the city I grew up in. Santa Ana is unique. It's the county seat. It's the central core of our county, And it's been home to me since 1965, since my family arrived here from La Paz, Bolivia. And so, I have not only, a love for Orange County, but a love for Central County, especially, and really, a love for people who have come to our county and our state and country as immigrants. I'm an immigrant myself, arrived here as a young child, and so have seen the county evolve. So I'm really excited about where we are. I feel we're at an inflection point here in the county where we see that it's evolved, it's grown, it's become more diverse. But with that has also come, not only opportunities, but also challenges. And we all know that healthcare is one of them. So I want to tell you that, not many cities delve into the area of healthcare for its residents, just because municipal jobs for us are potholes and making sure parks are funded and cared for, streets and our police department and fire department. So we didn't really have that experience, except for a couple of cities that have their own public health agencies like Pasadena and Long Beach and others. We didn't have that experience as we rolled into the pandemic in Santa Ana, but we learned very quickly that we had to pivot. And as a city, as a community, as many people did, we just had to start making ourselves very familiar with how do we deliver care, how we support people. And so, we did that. We also realized that we needed to have partners. And that's one of the reasons that compelled me to run for this office was, to make sure that we have relationships at the county, because it really is the principal place where, healthcare is governed, is dispensed. And I know that for me, the relationships I want to have with the cities, not only in my district, but the cities throughout the county, is one to create a better system of care and a better system of delivery of care. So I know that, as mayor, I leaned in pretty heavy on our community partners, and they are the ones that helped me, dictate the policy that we were going to be, introducing and eventually adopting, at the city. And just to give you a little bit of background, we did things at the city that were really, really incredible and sort of landmark public policy. We did, affordable housing at a level that is really not matched by any other city in the county and not by many cities in the state. We did so much to meet our what's called our regional housing needs assessment goal. We exceeded what the minimum amount was, and we received an A+ from the state on those housing efforts. But we also did rental assistance and rental stabilization. We saw that that healthcare for residents is so tied to housing, making sure that people are not insecure about where they're going to live, whether they're going to have a roof over their head, and keeping people housed, especially during the pandemic, was so important that we were able to pass that landmark legislation. We also just try to change the culture in the city and make sure that people realize, we have a very vulnerable community, whether it's economically challenged, whether it's challenged, whether, immigrant status, folks that feel very, insecure, about many challenges that they have. We felt that we needed to step up and help them. So I leaned in with county, community leaders, and many of them were promotoras that you probably know. These are people that were leaders in their community that said, we need better housing policy. We need better, policies for immigrant communities. We need better policy for all our communities that don't have a voice. So that's where I believe, our efforts were really significant, because we listened to those, and that's where I see, this coalition really being effective. So I'm hoping we can do work together in the future. I want to be able to listen to you all as we, as I learn this space. This is something that to me is going to be a work that I'm going to lean into and dig into. And I just want to make sure that you all know that our office is going to be available, because I'm sort of at an intersection of many commissions and boards. So I was appointed and sit on OCTA, the Orange County Transportation Authority, the Commission to End Homelessness, the Behavioral Health Advisory Board, and the Housing Finance Trust. So that, in addition to being on the board of Cal Optima, that's at a pretty critical intersection of both housing policy, those who are unhoused, but most importantly, just healthcare and the delivery of healthcare. And I know that that is something that you all, have a great history in doing work in. So, next week at Cal Optimum, we're going to be looking at doing a first of a kind street medicine pilot program. So we're real excited about that. To me, that's kind of what speaks to, things that are important to me, meeting people where they are, delivering care to people, because we have a hard to reach community in Central County and District 2. And I know that the more efforts we make, the more success we'll have, because just opening up doors and saying, come see us sometimes is a bridge too far for many people. And that's where I see that we have to be a little bit more assertive in our efforts. But I look forward to those challenges, because I think, we saw even basic barriers like internet, and having people connect through an app was very difficult. And those are basic things that we all take for granted as people who are blessed. But not everybody is blessed with those, just basic lines of communication. So we have to be receptive to making sure that we change those, make those more accessible, and make those easier for people to find us. So, just know that, my sort of roots are in advocacy. My background is in, really working with community and having community lead on basic public policy issues. And that's where I hope, our office and, and your coalition and your members can work together. I'm excited about, you all teaching me learning from you, and being receptive to everything that, we're going to be doing in the future. But we have so much to do, but I feel like we're at a really incredible moment. The dynamic is really great, because I know that, we have, at least for me, I'm the new council member. Somebody called me the new kid on the block. I've never been called that, but I'll take it. So I just know that I'm going to be coming in with a different lens. There are some, board members here at the county that really do want to lean into this. And so I'm hoping, we'll give also a perspective that me being the first person from Santa Ana in over 74 years to be on the County Board of Supervisors, the first Latino in over 40 years really to be on the board. So these are perspectives that we need to sort of take advantage of, because they're dynamics that haven't happened. So we love it. And, I'm looking forward to working with you all. Once again, I'm a little, I'm hearing, I'm not able to hear you all. So it must be on my end. I apologize, but I hope that, you got what the message I'm trying to express, which is more one of partnership, one of collaboration, and one of an open door policy, working with you all. I'm looking forward to all the things that we're going to do together. Thank you.
Thank you, Supervisor. Thank you so much, Supervisor Sarmiento. We know how busy your schedule is, and we truly appreciate you taking time out of your day to kick off this conversation with some great insights. We really appreciate you, and we look forward to continuing to work with you. Good morning, everyone. Thank you for joining us virtually this morning. My name is Aurora Garcia Barrera, and I'm the Director of Policy and Government Affairs with the Coalition of Orange County Community Health Centers, where I support our team and clinic members in understanding policy and advocating for the changes our clinics and patients need. For our first session, we're going to lay some of the fundamentals around what we mean when we talk about civic engagement and advocacy, and our session is titled Advocacy and Civic Engagement 101. So as a quick reminder, to submit a question today to any panelists, simply write your question in the Q&A box, and our team will be aggregating questions, and we've set some time aside at the very end to address those questions. So we'll go ahead and get started with our session objectives. Can folks see that slide? Great, thank you. So as our session objectives, we are hoping to today create a common language on an understanding of what advocacy and civic engagement is. We also want to provide some practical tools and concepts to deploy an advocacy and civic engagement framework. And we want to demonstrate that advocacy is weaved into the culture of individuals and organizations. So before I dive in, I wanted to share 3 key terms to help us get to the shared language I just mentioned. So we could go to the next slide, please. Thank you. So for advocacy, advocacy is acting in support of a belief, a policy, or in recommendation of a policy. Education on an issue, amplifying the voices of others. And civic engagement is working together or as an individual to make a difference in the civic life of our communities and developing the combination of knowledge, skills, values, and motivation to make that difference. It means promoting the quality of life and community through both political and non-political processes. And civic health, it's the way communities are organized to define and address public problems, including a wide range of civic engagement indicators from social interactions among friends and family to the ways people participate in groups and communities. And it is how we engage to expand representation and shaping the policies that affect our health. You'll also hear me refer to the terms below, but we'll get into that in just a bit. Next slide, please. So why do we want to engage in advocacy and civic engagement? I'll tell you my why. My family. I was born in Mexico and brought over when I was just 2 years old. And I grew up being part of an immigrant and mixed status family, which came with a lot of challenges. I learned at a very young age that seeking something as basic as healthcare was very difficult. At 6 years old, I was already trying to translate for my parents for everything, from why the price of chorizo wasn't matching the grocery store ad to what a doctor was saying. So I grew up seeing a lack of cultural and linguistic representation in the healthcare system, the challenges of navigating a family of 5 in which only 2, my younger brothers, had access to healthcare, to dealing with the fear of being an immigrant and seeing my parents make really difficult decisions between things like paying for healthcare bills out of pocket to rent in some cases. So I began advocating for them at a young age. At 8 years old, I was advocating for a hospital to find me a Spanish interpreter. At 10, when my brother was born with a heart murmur, I was advocating for a second opinion. So of course, by the time I was a young adult, I was out in LA marching for immigration reform, and soon after professionally for Health for All to make sure everyone had access to affordable healthcare. So that's my why, my family, because we struggled with those challenges and we're just one of many families struggling. And though we've made significant progress, we still need to make more changes. Next slide, please. So why are we, as a collective here, and learning about advocacy? So it is important that we all come together to advocate for the health of our communities, that we create a shared narrative, one in which I or you can communicate what got you to this point in time to engage and lead this work, to the story of us, where we align over shared values and shared challenges, we hope, with the hope of creating some change together, to the story of now, where we can communicate clearly what those urgent challenges are that we need our communities to engage in and start acting now. And so as we continue this session, I ask you to think about a couple of things. 1, your story. What challenges did you or your families face? What choices that you have to make? And what was the outcome? And 2, how does your story connect to mine and that of others? And what are we going to do about it now? Next slide, please. So now I'm going to talk a little bit about Advocacy 101. So what is direct lobbying? That's communicating with legislators and or their staff with the intent of influencing legislation. And grassroots lobbying, it's how we communicate with the general public in an effort to engage them in influencing a vote of a legislative body. Advocacy always contains a call to action or a request for folks to engage. And how is it carried on? It's carried on in many ways. Simply asking your neighbors and family to stand up for an issue is advocacy. If you're a health center and you invite your elected officials to take a site tour, that is a way of advocacy because you're demonstrating to them the great work that you do. Scheduling legislative visits to talk to our legislator about what issues matter to us. And there are many more other ways, like emailing your elected officials, writing letters of support, engaging in social media. Next slide, please. So just really quickly, I want to talk about a few do's and don'ts of advocacy. And it's important to note that you should first check with your organization to check what their policy is for staff participation in any advocacy activities. So in terms of the things that you can do, lobbying, including direct and grassroots lobbying, is okay within certain limits. And my colleague is going to drop a PDF in the chat to go elaborate a little bit on these points. So don't worry about taking notes. Issue advocacy is also okay. So when issue advocacy is when you take a position on a public policy issue. So that's also permissible, but it is important to always stay nonpartisan. In terms of the things that you can't do as a nonprofit organization, any political campaign activity is prohibited, and any activities that support or oppose candidates for elected office is also prohibited. Next slide, please. So now let's talk about health centers and advocacy, and I'll start by saying you're an advocate through the work that you do. As a bit of background, the first official establishment of health centers and migrant health centers began during the civil rights movement of the 1960s, resulting from a core belief that access to affordable, high-quality healthcare be provided to all. So as 501c3 organizations or health centers, you can engage in advocacy to help improve healthcare access and delivery to their communities. Next slide, please. So why should you engage in advocacy? Well, because it's important to educate our representatives and hold them accountable. Because we must have a seat at the table, especially on any decision-making that will impact our health. And sharing your story is an important way to advocate. And when you're telling your story, you must remember you are the expert. And even when you feel like your story isn't special enough, remember that our stories help us understand each other and get to some common ground. Next slide, please. So now, regarding civic engagement, I'll start by saying that the IRS affirmatively states that 501c3 organizations may conduct voter engagement or connect with candidates on a nonpartisan basis. So 501c3s can engage in voter education and voter registration, can support or oppose ballot measures, can distribute sample ballots or nonpartisan voter guides. And some of the tools to do that in is through phone banking, door-to-door canvassing, and email blasts or texting. Next slide, please. So some things to, just a little bit more on civic engagement. Engagement is not just about voting, although that is a part of it. There's more that you can do to be civically engaged, such as participating in the citizen. If you're a legal permanent resident and you're able to naturalize, the fact that you become a naturalized citizen is also a form of civic engagement. When you participate or you hold trainings on things like civic engagement and voting, all of that is civic engagement. Basically, any work that you do to ensure that people have a voice in the democratic process is civic engagement. Next slide, please. So for health centers specifically, why should you engage in civic engagement? Because you have a direct access to patients. So I will go through this very quickly because we will have our amazing presenters talk about this a little bit more in just a few minutes. But what can you do in clinic to engage your patients? You can have resources available on voter registration. You can provide handouts. You can show videos in your lobby area. You can hang voter registration and education posters, and you can train your teams to answer questions like, where do I find my nearest polling location? And where can I learn more about the election? Next slide, please. So in terms of some of civic engagement do's and don'ts, on the do side, you can and you should engage all candidates in your region. Again, you have to stay nonpartisan. You can host candidate forums to discuss some of the issues that you care about. You can educate on the health center program, And again, you could take a position on a ballot measure. In terms of things that you can't do, you cannot talk about an election in a way that could be seen as partisan. You cannot endorse a candidate, and that includes making a contribution for or against a candidate. And you can tell your patients and you cannot tell your patients who to vote for, even if they ask, and folks will ask. So at this point, it's important to always have the appropriate resources available so that you can redirect them to get that information. Next slide, please. I just also wanted to give folks a quick overview of our state legislator in Congress before we get into talking about the budget and how to pass a bill. So in California, our state legislature is made up of 120 legislative districts, of which 40 are Senate districts and 80 are Assembly districts. And at the federal level, our United States Congress is made up of 100 senators, 2 of which are in California, and 435 members of Congress, of which 52 are in California. And we can share the links to find your representative if you're not sure who your representative is. Next slide, please. So I wanted to give a quick overview of how a bill becomes a law. So I'm going to use SB 75, the Health for All Kids bill, as an example. So a bill has to start at the House of Origin. So in this case, since it's a Senate bill, it'll start in the Senate. Then it will go through various policy committees, and these could range from Senate Health, Senate Budget, Senate Labor, Senate Education, depending on the bill. And then it will go, and then if it moves forward from that, it will go through the Appropriations Committee, in which they will review the fiscal impact of the bill. And if it makes it out of that committee, it will then go to the floor for the whole Senate to vote on. If it passes that floor, it will go into the second house. In this case, the Assembly. And it will go through a similar process of going through policy committees, Appropriations Committee, and then the floor. If the bill is not amended, it can go directly to the governor. But if it is amended, it will have to go back to the House of Origin for another vote. And then it will go to the governor. And then the governor can decide whether to sign, veto, or take no action. If the governor signs the bill, then the bill becomes a law. Next slide, please. So in terms of the California state budget, the process generally starts in January when the governor releases a proposed budget by January 10th. After that, between January and May, it's going through a series of budget committee hearings where they are discussing specific pieces of the proposed budget. And then in May, the governor releases what's called the May revise, or a revised version of the budget. And this has to be done by May 15th. This is why we're holding this event today, because we are right in the middle of the process and we still have plenty of time to influence what the May revised budget will look like. After the May revise, it will go through another set of hearings between May and June. And then in June, a final budget 15th at midnight. Next slide, please. In terms of the federal budget, similarly, the president submits a budget proposal in February, usually. This year, I believe he released it on March 9th. And then it goes through a series of hearings between February and April. And usually by April, we arrive to a budget resolution, which is similar to the May revise component. After this, between May and October, the House and Senate have to meet to reconciliate and negotiate specific budget pieces. And then they propose appropriations actions during this time. After that, the fiscal year begins on October 1st. So usually if the budget is passed, it will begin on October 1st. Not always does a budget pass, and if it doesn't, then the previous budget is what applies. But I know for health centers, this year is really important because we have to get health center funding reauthorized. So we've been doing some advocacy on that. So again, we're right in the middle of that process to influence what the final budget's going to look like. Next slide, please. So I know I just went through that super quickly, but I just wanted to flag that at the coalition, we are planning to hold a follow-up series of trainings on different things like how to become an advocate, how to create your story, how to create and share your story, how to engage in voter registration and education, how to train your teams and secure staff buy-in, and how to learn more about the legislative and federal budget process and do things like submitting a public comment or writing a letter of support. So with that, we really want to hear from you all. We want to know how else we can support you in engaging in advocacy and civic engagement work. What kind of trainings are you interested in? So feel free to drop that in the chat. And I know that our event survey will also ask you about that. Next slide, please. So you're all probably thinking, this sounds great, but I don't have time to do one more thing. But again, we just need you to reframe that. And we want to think about how you're already doing this work. For example, every time we go to the doctor, we're advocating for our health. And as a physician, when you come across an issue like, well, this patient always cancels their appointment because they don't have transportation, how do we address that issue? We talk about the importance of telehealth. Or when you have a parent who doesn't have insurance because they're undocumented, we talk about needing health for all. Or we talk about things like student loan forgiveness and climate change and reducing gas emissions. And guess what? Every time we're talking about those issues, we're engaging in advocacy. And advocacy is a tool towards finding a solution to a lot of challenges we're facing. And you can do that on your own, or we can do it together. So just some key takeaways. We hope that during this short time, we created a shared language around advocacy and civic engagement. We began understanding the legislative and budgetary process. We began highlighting how the work of healthcare providers is a form of engaging in civic health and learned about other ways of engaging. So we hope after today's session, you will leave with an understanding of your role within advocacy and civic engagement, but most importantly, that you're not alone. And we have resources and tools to help make that possible. So stay tuned to learn from the rest of our amazing speakers how to put what we just discussed into action in very practical ways. Next slide, please. So with that, I am super excited to share that joining me in this session is Dr. Ilan Shapiro, Chief Health Correspondent at one of our member clinics, Ultimate Health Services, and he is going to talk about how he uses his platform both in the clinic and on social media to engage in advocacy. Welcome, Dr. Shapiro.
It's a pleasure to be here, always, always, always. And I'm impressed on the things that have changed. And just a reminder, the year today is 2023. In 2020, we saw a lot of things that were happening in our communities, especially with underserved communities of color, the Hispanic community, African Americans, and we saw a way big disparity between services when we got actually testing, when we got everything, and most importantly, sadly, the outcomes of what COVID-19 actually came upon our communities. We were the ones that were in the hospitals. We were the ones that were actually having more complications. And a lot of people may ask, like, is this something related to the virus, genetics? But sadly, no. It's something called social determinants of health. Social determinants of health played a role on decades to unprepare our community for these troubling times. At the moment that we were actually on the pandemic, the problems that we had regarding food, our chronic diseases like diabetes, hypertension, problems with obesity, depression, anxiety, mental health, all of them played a crucial role of breaking our barriers and the potential of our communities to be better prepared, or to be more resilient against the virus. This was a quick reminder to all of us that this needs to change. And sadly, and I have talked to you, Aurora, about this many times, that at the moment that me as a physician, that I'm inside of my community clinic in Altamed, that we're serving a lot of the community members that were hardest hit in the entire United States. At the moment that I was there, well, I could propose things, I can do things, but I know that at the moment that they leave the four walls of our clinics, that's where the magic happens. That's where, I can tell them, make sure that you're eating better. make sure that you're doing things. But the reality of my community that I serve is that they have multiple jobs. Then asking them again to get, the booster of the booster for the booster was hard. Or just make sure that you, instead of having this type of food, get another type of food. And they live in first of all, access to food, it's hard. And also the economical burden that they have, it's actually high. And we have a lot of things there that are making a huge difference for our communities. Then all of this, that's why it's so important to advocate and go out there and make a change. Why? Because the magic happens when they leave the community. They leave my clinic that I'm serving. That's where the magic happens. When we start changing the way that our zip code actually determines the health and longevity of our communities, the school districts, the roads, access to food, mental health, all of these things have a huge pressure. And if for anybody that actually is hearing us right now, me as a physician, if you give me all the money that you have and all the physicians and all the best hospitals, I can only change 20% of that healthcare, that wellness of my patient. That 80% is social determinants of health. That's why it's so important to communicate in a culturally relevant way with our communities. We have done so to actually be there with them. And it's very important. One thing is what we want to tell, and the other thing is how our community wants to hear it. They're having multiple jobs, they're jumping from one side to another. It's not about education, it's about giving the correct tools at the correct moment to make sure that we're taking care of absolutely everybody in our community. That means that at the moment that we go, and I'm going to give you two examples of the things that we did in social media that make that huge difference. We went out there with Andale que Esperas. It was a campaign for vaccination and actually create trust and give the tools for our community to get and be informed to make sure that they are deciding if they wanted to get the vaccine or not. At the end of the day, it's our choice. But if you do not have information and you do not have it in your language in a cultural relevant way, well, we can actually cry and jump and scream, but it will not get the message in our hearts, in our souls. Then that's one of the things that I loved. And for everybody that actually knows El Chavo del Ocho, he joined the campaign. He was part of actually the things that we were doing to make sure that we were creating conversations. And the objective was that our community is not that they're lacking things about education. No, they're jumping from one side to another. But when they hear the message, they go, well, that's interesting. And instead of just being neutral and not doing anything, they actually take action. They ask their doctor, they ask their nurses, the community health workers, las promotoras, los promotores, and they start that cycle. And moving forward, even better, with My Vote, My Health, when we empower our community members, including the OC, the coalition in OC, that we were all working together to make sure that our community understood the importance of being represented. Because, I don't know if it happens to you a lot, but at the moment that we are on a conversation, we can tell ideas, create maps, create plans, but in order to change things, we need to be on the table. If we're not on the table, we're the main dish. Hear me out, the main dish. Then we can complain, we can do a lot of things, but at the moment that we went out there in social media, knocking door by door, and making sure that people understood the importance of their conversation, of their representation. And a lot of people were like, well, you know what? One vote will not count. But at the local level, at the moment that we are represented, it makes a difference. It makes a huge difference for the schools of our kids, for the future of our community. Then all of these things actually empower ourselves to make a difference. Me as a physician, and I actually took my white coat and it's here. We need to be part of the conversation. Healthcare providers need to be part of this conversation. The entire community, we need to unite and be part of this. Why? Because if we do not create that feeling to change our environment, because our communities live near highways, we have a lot of pollution, we have a lot of things, and we have the side effects of them: asthma, like problems with our bronchitis, allergies. We have all of these things happening to our community, and that decreases the livelihood, the quality of life, and most importantly, the future of our kids. Then those are the crucial things that we need to do. Now, what can you do that you're on the other side of this monitor or device that you're actually seeing us? You need to ask yourself, and there's kind of 3 levels of engagement. The first one is get information, do your stuff. Make sure that you're advocating for your things. Make sure if you don't like something, understand who are your representatives. How can you actually unite all the things that you're doing? And most importantly, act. The second part is that, you go like, I'm not a creator. I'm not going to go out there, but at least share the information that you're hearing today. The moment that we're starting to share that part, that's a beautiful part of social media. When we have a message that is actually relevant to us, we need to cross a lot of hills and a lot of barriers because we're competing against a lot of messages. But sometimes the message, the true message, the good message is not heard. Why? Because we do not reply. We like to reply about that funny video, or we want to actually resend in WhatsApp. Other stuff, I implore you, make sure that you are sharing this information with anybody that you have around you. Because this way, it's neutral, it's empowerment, and most importantly, if you want change, because all of us want change. There's things that we need to improve in OCLA, in the world. Then if you're not part of it, we're just not doing anything. Then I want to be part of the change. I want to be part of that movement. I want to actually do something and tell my kids that I was part of the fight to make a better future for them. And it's never too late. Even that way, there will be good days, there will be bad days, but it's never too late. And right now, we have seen sadly what's happening with, in Nashville. We have seen all these things that are happening all around us. We can actually do things. We can actually move forward this conversation. And most importantly, choose the right thing. We have heard about misinformation and disinformation. You can become fighters on that fight. And there's 2 ways. One, making sure that if it's funny, weird, and it doesn't sound right, the post that you're having, do not reply to it, do not engage to it. Just put it on the side. Don't even share that WhatsApp message. But if you are here, for example, with the coalition, you're hearing stuff with, the stuff with Altamed, and you're hearing stuff from certain, places that you feel comfortable with, and they are sharing good information, make sure that you share that part. Why? Because if not, all the efforts that we have and all the things that we have right now will be in deaf ears. And all the efforts and all the cries and all the things that we're having will not be shared. And that's a problem that we have right now, Aurora. And that's part of the things that we need to actually be putting in front of us. Why is so important this? And this is my last call before, I open the forum for everybody. This is the moment to act. It has never been such an important moment for the community. Why? We have never been represented the way that we are being represented right now. We have not had the opportunity to be in these tables. We have so many ideas. We are here. We can actually be represented. And if you can vote, awesome. If you cannot vote, make sure that you're sharing information. You can still do stuff. And most importantly, as groups, as societies, make sure that we talk to each other. The key here, and one of the things that I actually really appreciated from all COVID-19, one of the things I understood was that communication is a key aspect that we sometimes relegated as healthcare providers, as physicians and nurses, mental health providers. That's something that we didn't engage in a lot of things. But if we really want to change the system, if we want to make sure that our kids have a better school, if we want to make sure that like la abuelita actually gets her diabetes medications, we can do something today. Then I throw this through the universe. We are here for you. This is not something new. We already have things that have worked for us and we're sharing it, and things that actually did not work that well for us, and we are sharing them too. That way we do not carry the same mistake again and again. The key here is that creating this coalition, creating these conversations are crucial for absolutely everybody that is hearing this conversation. Then, Aurora, thank you so much for the opportunity. I'm here. I will be here for questions, and I do not see any questions on my side, but I'll be here.
Thank you, Dr. Shapiro. And yeah, please feel free to put your questions in the chat box, or if you're on Facebook or YouTube, in the comment section. It looks like we do have time for one question, Dr. Shapiro, that came in.
Adelante.
Where can we find more of you? Where can we hear you share all of your insights and engagement opportunities?
That's Aurora. That's a great question, and I will be posting it on the chat. We have a beautiful conversation in Altamed called Conversaciones Vitales that happens every Thursday. It was born with COVID-19, and the idea of it is to make sure that we have relevant health news for our community, information, and what's actually trending. That way, in a quick 10 minutes, 15-minute part, it's a video. We try to make it engaging. They can send questions, and have that part. Then that's the first one. The second one, with the Altamed social media stuff, we are very active with making sure that we're engaging in Facebook, YouTube, and Instagram. And of course, you can send, there's other stuff that I'm doing with Dr. Shaps in Instagram, Twitter, and stuff like that. Then, and I try very hard to do it Spanish and sometimes in English to make sure that our community also has that counterbalance for the conversation.
Great. Thank you so much, Dr. Shapiro. And I think it's time to move on to our next session. But if folks have questions, please continue sending them. We'll either try to address them at the end, or we'll follow up via email with those questions. So, Dr. Shapiro, thank you so much for sharing your insights, and thank you for all that you do for our communities and to engage them and inform them with really reliable information. We love that you always start your social media videos with the bright and enthusiastic familia. So you really do make us feel like we're a part of that community. So thank you so much. We appreciate you joining us today.
Always a pleasure.
Thank you. So up next, we have our second session, Advocacy in Action. And in this session, we'll be hearing from two amazing experts and leaders in the field of civic engagement who have implemented a civic engagement and advocacy model throughout their clinic sites. And they have successfully implemented nonpartisan voter outreach techniques, both in their clinics with their patients and with members of communities in the footprint that they serve. So with that, I am excited to welcome Berenice Nunez Constant, who is a Senior Vice President for Government Affairs, and Rolando Chavez, Senior Policy Analyst at Altamed Health Services. Welcome, Berenice and Rolando.
Thank you. Good morning, everyone. Thank you for having us today. We're excited to talk to you about civic engagement. So will you all be displaying the slides? Awesome. Thank you very much. And so if you can take us into the next slide, we will be, again, talking to you all about civic engagement, talking to you about, well, that looks a little different. Okay, hold on a second. I'm trying to wait for the slide here. All right, thank you. So we're excited to talk to you about civic engagement and why we do what we do here at Altamed. And we're also excited to share all the resources that we have in store. We really do consider this to be a very innovative approach here at Altamed. And so here's why we do the work that we do. So community health centers have to have a 50-year plus legacy of social justice in the communities. And so we believe that out of all forms of inequality, injustice in healthcare is the most shocking and inhumane. And so because we believe this, we believe that part of caring for our patients is also to care for the conditions in their communities that make them sick, which we call the social determinants of health. And we also believe that there is a direct link between civic engagement and the health and wellness of a community. And so think about it, right? Why is it that's, we see our communities that are often the sickest also happen to sit at the level of low levels of civic engagement and under-resourcing in communities. And so, and a lack of representation. So there has to be a direct link. And we have proven actually that there's a direct link in the level of civic engagement and the level of health and wellness of a community. And so our solution is to utilize community health centers as a catalyst through which we can reach vulnerable communities and engage them in the democratic process so that they could have representation and really become their own champions for their communities. Next slide. Okay, so I wanted to take a moment and show you all a visual representation of actually our community health centers literally sitting at the intersection of social change. Here is an example of our ultimate service area and where our community health centers are. All of the red dots are where we have community clinics or some sort of like an office. And then if you overlay just in the yellow, the level of propensity or the low propensity voters, and we identify those in our region, and then we overlay the hard to count census tract, it's really easy to see that it forms the perfect storm here in our communities where we can clearly see the connection, right? In this photo here, low level of propensity voting history and hard to count census tracts means that resources, those that are in the decision-making position to bring resources to our community, this shows that how the under-resourced communities actually come about, right? And so these two factors are really kind of the reason why community health centers can really bring that social change to community. Next slide. Okay, and we also know that, and I think, as healthcare providers, we also know that, only 20% of someone's health and wellness can be delivered in an exam room. The rest of it is in the community. It is really, their social behaviors, but also their community environment where they're living in. And so because of that, we believe, and we have now instilled a practice where we know that we have to go well above and beyond and reach outside of the healthcare system to be able to care for the health and wellness of our patients in the communities. And so we have again proven through this work that Ultimed's movement building is really increasing community power, and that it's possible through the activation of community health centers. So why community health centers? We are long-standing trusted messengers in the community. And by design, literally, like the federal government gave us the federally qualified health center designation because we are in medically underserved areas. And so we're located in some of the most underserved communities across the nation. We have the infrastructure to reach these hard to reach communities, which was proven by far during the pandemic. And here's the opportunity. 1 out of every 5 Californians, 7.4 million patients are served by community health centers. And nationally, community health centers serve 29 million. So imagine if we would be able to take this model that I'm going to walk you through on the next slide, through our community health centers, the amount of community change we would be able to create. Next slide. So at Ultimed, we've developed what we've coined an integrated civic engagement model. This model, we have validated it through not only the numbers that we're collecting because we measure everything, but we've also proven that it's replicable. We have, various campaigns, at least 2 presidential campaign cycles now under our belt, that demonstrate that community clinics are an effective hub for civic engagement in our communities. And so we have 3 prongs to our approach. We have the community engagement component, where we're following the traditional campaign model, and we're actually going out into the community and we are knocking on doors. That this is one of the key pieces where the folks who are in the civic engagement space often tell us that this is like the missing piece. They can come into a community and do this work, but typically they don't have infrastructure established in the community, right? And so we're not coming in and out of these communities. We're there 24/7, 365 for more than 50 years. And so then we can use that ultimate brand, that, a community health center brand, and bring that to the community and literally to our patients' doors. And the second component of this is actually the in-clinic engagement. We hire from the communities and where we're in. And so we don't see so we want to also leverage the power of who is working at our community health centers, but really maximize that patient experience and overlay civic engagement in their experience when they come in and visit their doctor. And then there's a mobilization cycle that we've been able to build, that we've included as part of this integrated civic engagement model that includes the issue advocacy and education. This is all nonpartisan. This is all part of what community health centers are here to do in terms of our social justice principles. And so there's an issue education and advocacy component. Voter engagement is a core component of our mobilization cycle, but so is leadership development, really building out and supporting new advocates in our communities. But also we are actually to the point now where we're doing short-term community projects. So working directly with communities on issues that are important with them and supporting them through, getting to the change that they want to see. And then we're doing community-based participatory research to really inform the policy changes that we're bringing to the table. And so there is a whole mobilization cycle, and that is our civic engagement model. And on the next slide, I'll show you just some of the outcomes just from this last year. For our Get Out the Vote work, which we call the My Vote, My Health work, or Mi Voto, Mi Salud, last year we reached over 500,000 voters in California for the primary and general election through phone banking. We did door-to-door canvassing and peer-to-peer texting, really reminding folks, hey, are you registered to vote? Do you know where your voting location is? And really supporting them through that process. And for the first time ever, we formally included a white coat advocacy day where we brought our doctors out into the local communities of Southeast Los Angeles. And they were literally knocking on doors. And then we're also building out a training program so we can build out how we leverage the white coat and advocacy that we do. And finally, we are engaging our physicians very specifically in our state and federal advocacy. So now they are at the table with us, testifying at hearings, calling in and giving their comments and serving as experts in the work that we are doing. Next slide. And then here's another example. Ándale que esperas. Come on, what are you waiting for? Was our campaign that was funded by HRSA and HealthNet for statewide COVID vaccine outreach and education, for really the purpose of vaccine equity for Latinos across the state of California. Ultimate was the only community health center that was funded because we had this proven model to demonstrate that this outreach, that we could effectively do this outreach. And so in this work, we were able to hire and train 146 community health workers or promotoras across California, administer more than 130,000 vaccines to Latinos, and scheduled over 28,000 vaccine appointments. And then we also delivered over 313,000 support services to our communities. And so we're really proud of this work. Through Ultimate, we were really also able to make this a very culturally appropriate and culturally aligned campaign. And so the materials were very much looked like the communities that we were trying to reach. And so there was a lot of power in this. So this is how we also utilize our integrated civic engagement model for not only voting, but also issue advocacy. Next slide. And so I know you all probably want to know how we do this at Ultimed. And what I will say is that we've been really successful because this civic engagement work at Ultimed is a critical priority of our executive leadership team, all the way up to our CEO. In fact, our CEO, Castro de la Rocha, is our biggest champion in this work. And so leadership buy-in is critical for this work. We at Ultimed were bold, and we actually took the step and made the investment to establish a civic engagement department with its own budget and cost centers and its own dedicated resources 365 days a year on election years and off election years, so that we can build literally a movement. We've also identified and created specific process flows in partnership with our clinic leadership so that we can ensure that the provision of care is never disrupted, right? Because we are here to provide healthcare. That is number one. But again, in partnership with our clinic leadership, we now have a process flow for this work across our clinics. We also have integrated voting at Ultimed. Right, we worked with leadership, and our employees were asking for voting centers at our clinics. So now, and even our corporate offices. So now we use our clinics and our corporate offices as voting centers and for patient outreach as well. We have a specific staff engagement strategy because, as I mentioned earlier, our patients equal community in our eyes. And so there's a lot of power that we can build also as not only through community, but also through our own workforce that really, share the strong mission of community health centers for this work. We've also included a component in all of our trainings for medical residents and providers around the importance of civic engagement and civic engagement as a social determinant of health. And we're engaging our providers very directly in this work. And finally, our integrated civic engagement model that we've built out, we've demonstrated how effective it is. And now here at Ultimed, we're utilizing this model as a strategic approach across our business to engage patients and communities in existing and new prospective service areas, or if we're wanting to inform a community around the Medi-Cal redeterminations or whatever it may be. This model now serves as that catalyst in order to do that work. And so next slide. With that, I will invite you all to, if you all want more information, everything that we've built out with this model is available for you all to access and share. We want you all to join us in this work. So if you want to learn more, please go to myvotemyhealth.org, sign up for our newsletters. There's volunteer opportunities coming up, but also you all can engage in a lot of the power building work that we're doing in this in-between year as we look to next year's presidential election. But there's toolkits, civic engagement toolkits. You all can add your branding and logos to everything. And of course, if you have any questions, please, I'll drop my name and email in the chat, and you all can reach out to us directly. Thank you.
Awesome. Thank you so much, Berenice. So after that great presentation about all the civic engagement work that we do, I'm going to be speaking about one specific program that we have been slowly building, right, and working hard to improve and make it better every cohort, and that is our Ultimed Advocacy and Leadership Academy. As a community health center, as was mentioned already, we understand that as a trusted organization, we have a responsibility to provide quality care for our patients, but also advocate on their behalf, right, and guide them through that advocacy. With this program and all the civic engagement activities that Berenice just spoke about, we go beyond and we help our communities advocate for themselves. Next slide, please. So what exactly is Advocacy and Leadership Academy? Well, the program aims to provide the tools to encourage advocates in our communities to become civically engaged and advocate on behalf of Ultimed. and our patients and on their own within their communities. So after the program is over, we hope that they have enhanced public speaking skills. They understand the legislative process, and I know we went a little bit through that legislative process today, and it's very similar, right? Just giving a brief reminder of what that process is, and basically we work on having them become active participants in their community and with their community health center. Next slide, please. So with that, I'm going to break down the Advocacy and Leadership Academy as of today. It's a 6-week program, training program. We meet every Saturday morning. Sometimes that does change based on flexibility for our communities. But so far, Saturdays have been the best days for everyone. It's a 5-module program that I will introduce later on in the next slide. We've had 7 cohorts since the fall of 2020, and we're currently doing our 8th cohort. So tomorrow we have session. At the moment, we've had 89 graduates, but after this cohort that we're currently doing, we would have reached the 100 graduate, which is a great milestone for the program, as we've seen tremendous growth within the program and interest across the whole state, right? Because we've had interested participants from Northern California, the Central Valley, and down south in San Isidro and San Diego. So for the cohort that we're currently hosting, we actually received close to over 250 applicants. So that is telling us that although our resources are limited, we need to do more. We need to continue to engage our communities, but we need to do it all together, right? We need to come together as community health centers and provide those services for our community. In addition to all that, we also host each cohort. We host them both in English and Spanish. It goes back and forth depending on the cohort, but we try to be accessible. So some cohorts will be in English and other cohorts will be in Spanish, and we hope to continue to expand that, of course. The demographics and those who can apply is anybody who's 16 years of age or older. It's open to all professions. It had been focused in Southeast LA when it first started because it was a small program. We struggled to get participants, but now it's open to all of Orange and Los Angeles County. And as I mentioned, the application, anybody can really access that, right? Because we post it on social media, and we've seen an increased demand for the program itself. Currently, in order to make it more accessible and to be able to build a module that can be replicated in other community health centers, we are working on a facilitator guide and a toolkit that anyone will be able to download and incorporate into their own training within their own organization or health center. Next slide, please. So now I'm going to go a little more into what our curriculum looks like and how and where it begins. The curriculum really begins with the community member, right? When we're doing outreach, when we're communicating with them, it starts with the community member. Being able to understand the existing systems and also understanding the community, which is what we've done through all the advocacy work that we've done and civic engagement work that we've done, allows us to continue to improve the program, but also improve the lives of everybody who participates and everybody who lives within the communities that we serve. We understand that the existing systems need improvement, and for a very long time, many of the communities that we serve have been underserved. So it takes advocacy and education, not only for our community, but also for our elected officials to get the work done. So as you can see on the screen, these are the major parts of our training. We start with the community member. We do a brief government 101 session. Then we incorporate research and how it can be used to impact policy, right? And we help them incorporate that into the story that they're building throughout each session. We also invite elected officials to speak with participants. There's been times that we've actually got the opportunity to take our participants to Sacramento to do advocacy, and we hope to continue to incorporate that now that now that it's more accessible since the pandemic. And then throughout throughout each session, all the 6 sessions, they slowly start building their story. And we do that until it's finalized, right? And it doesn't mean that that story is just on that specific issue. So if they chose healthcare, that doesn't mean they have to stick to healthcare. It is they are easily able to change it if their issue changes as well. Next slide, please. Also, so as you can see on this slide, within each session, we also have gone as far as creating what we call a safe space for a discussion. This can be any topic. It can be on current events or on any issue that they're having within their community. So they can have the freedom to speak about it and talk to their peers about the issue and possibly come up with solutions. Once we begin the session, the ALA participants take lead in this conversation, and they slowly begin to build their story without really noticing what they're doing. Next slide, please. Perfect. Now I'm going to share a little more about the impact of the program. Next slide. So ALA allows Ultimate to build community power and ensure our patients and our communities are heard by being front and center of our work as healthcare systems. Therefore, we analyze the program every session to make sure that the community is seeing a benefit. And also every cohort, we have a pre and post survey that allows us to improve the cohort. So the first session, we post the pre-survey, we post it, we give them a few minutes to fill it out. And then at the end, during our last session, we also post another survey that allows us to understand what they've learned and what they felt was missing. This is actually how our safe space discussion came about. Many of the participants felt like it was a one-way conversation, and that's not what we were trying to build. So we then incorporated the safe space discussion where the conversation was led by the participants. So that is how we slowly are able to improve cohort by cohort. And that is why we are today where we are, and we've been able to graduate so many participants. Can we go to the next slide, please? Perfect. So after graduation from the program, participants have reported, and this is what we've been able to see in the surveys, that they can communicate and engage with elected officials. They feel like they're better advocates. They understand advocacy better. They understand that there is power. So they feel empowered and that there is power in their voice and their story. Lastly, they understand the importance of addressing the social determinants of health through the advocacy that they're doing. Next slide, please. So ALA is just the first step in what we have here at Ultimate. It is the first step in each participant's advocacy journey, because after ALA, they are actually able to get involved with some of the programs that Denise mentioned earlier, like My Community, My Health. Also, Partner SELA, which is a community research program that is led by our institute, as well as the SELA Health Allies. And then we also get them involved in the GOTV campaigns and canvassing, and we also send out calls to action that they can get involved in. So after they graduate ALA, it doesn't end. We continue to keep them involved and help them with that advocacy. Perfect. Next slide, please. Now I'm going to talk a little bit about what is next. What is ALA doing? Because it is expanding. Next slide. Awesome. So now developing a provider and clinician ALA. We are now working on developing a provider and clinician ALA, which we've begun to implement with our family medicine residents. This came from direct requests from our physicians who want to be more involved and are interested in being more involved. They want the opportunity to create systemic changes because they understand the challenges that exist within the community. Next slide. What does this development consist of, though? Well, we have seen how much our providers are drawn to the social justice mission of community health centers, and it's big, and it's a big reason why they do the work they do. And it's also a big reason why they come work at a community health center. And by getting involved, our doctors are able to build better relationships with patients. They have a better understanding of the community, and it gives them the opportunity to raise their voice on behalf of other patients. So we have, as Bernice mentioned, we have been using white codes for our advocacy. Ultimate does a lot around training future providers through our residency programs and our fellowships. And we've been moving health centers to helping community build power to address health inequities by bringing providers into the advocacy. And it creates a competitive component among healthcare, right? Among healthcare centers. We have the opportunity to attract talent because physicians want to be civically engaged. They want to go beyond the four walls within the clinic. So if we can go on to the next slide, and we'll go into the key takeaways. Awesome. So now we're going to talk a little bit about some of the key takeaways from both of the presentations. And then we can go to the next slide after that. Here on the next slide, you can find all the systemic changes, all the key takeaways. So overall, we want to create systemic change that improves the lives of our patients and employees and communities by addressing the social determinants of health. Because we are trusted messengers in our communities, we are the infrastructure that has been put in place to help underserved communities. We must continue to engage our patients. We have the responsibility to lead as social justice champions and build culturally competent programs and uplift our communities through those programs. Lastly, ALA, like all programs, builds community power, and we hope to continue that. Next slide. And now with my closing remarks, I just want to leave everybody with, by emphasizing that we have a responsibility. We must continue to uplift our communities and work hand in hand with them to make some systemic change within the communities. Perfect. Now I'll stop there and open it, and we'll open up to any questions.
Thank you both so much. We're right at time, but we did get a couple of questions, so I at least want to ask one, and then hopefully we can follow up on the rest of them via email, or if we have time at the end. But can you all share your toolkit that others can adopt to create a civic engagement department?
Hi, Aurora, and thank you for the question. We haven't developed an actual toolkit for how we've developed the civic engagement program, but you all just gave us a really good idea, right? So we, as the largest community clinic here in California and the nation, we always think about what is it that we can build out using our resources to be able to bring other community health centers, community partners along. So thank you for that question. It really does leave me with that next thing to do. So be on the lookout. We'll start thinking about how we can develop that as an actual best practice and a toolkit so that folks can join us in this work. If anybody has any specific questions, I've shared my contact information in the chat, so feel free to reach out to me directly.
Thank you, Rita. And I think with that, we'll wrap this session. So thank you both, Berenice and Orlando. We really appreciate everything that you share. And it's super easy to see the civic engagement and advocacy framework at Ultimed. And you've given us, I think, all a great model and insights to implement and aspire to. So thank you so much for your time. So really quickly, before we move on to the next session, which I'm really excited about, we did have a question in the chat that I just want to address really quickly. And this question was around the blurred lines of talking about issues that are not really partisan, but feel like they are partisan, such as abortion or gun control or immigration. So just really quickly, I just wanted to say, I love this question. And it's one that I think we should really dive in deeper on during our follow-up training. So please be on the lookout for that. But when it comes to 501c3 guidelines, speaking on these topics is still considered issue advocacy, which again is permissible. Unfortunately, I do feel that some politicians and even the media, to a certain extent, have really politicized these issues, but they're still nonpartisan issues, so we should talk about them. So if you want to talk a little bit more about strategy on the narrative and how we approach that, depending on the different members that we're speaking to, please send me an email and I'd love to strategize and follow up with you on that. But we'll definitely cover that in our follow-up trainings. So thank you so much for asking that question. So up next, we have an amazing presenter and moderator, and also a group of panelists who will be joining us in our coffee chat. For this, I'll be turning over the microphone to Vice President for Policy at the Latino Community Foundation, Christian Arana. So Christian, the session is yours.
Awesome. Thank you so much, Aurora. And good morning to everyone that's tuning in today. I'm going to try my very best to have a robust conversation in the short amount of time that we have. So just to get to it, as Aurora mentioned, I'm Christian Arana. I'm the Vice President of Policy at the Latino Community Foundation. We are California's only philanthropic organization that's focused on the Latino community in California. So from Orange County to the Central Valley to the Bay Area to all across the state, we want to make sure that we are investing philanthropic dollars, but also public dollars into our communities. And that often requires a lot of engagement with legislators and their staff, which is the point of today's conversation. So joining us today is Ryan Yamamoto, the COO of the Coalition of Orange County Community Health Centers. Christy Ward is also the CEO of Share Ourselves in Orange County. And then finally, Al Jabbar, who's the Chief of Staff for Orange County Supervisor Doug Chafee. Welcome to all of you. I believe there might be a slide up, but let me know if you can't see it. Just very quickly, just some helpful tips as we start to begin this conversation. And mind you, these are not all encompassing, right? I know the panelists will also share their stories and their successes on how they've been able to achieve great outcomes for their issues. But when it comes to dealing with elected officials and their staff, there's just a couple of things that I just want to pull out. Persistence and consistency is crucial. There are a million and one things going on in the community, and constantly people are just bombarded with a lot of things. And so making sure that you are top of mind for a staff member or even the elected official themselves is critical. Staying informed, right? What's going on? What's the most relevant information going on in your specific issue or in your community? So making sure that you are ahead of the curve and understanding of how to uplift and actually address the problems that are facing your community. Timeliness is also crucial. Are they in session right now? When's the next city council meeting? When is the next committee for such so-and-so county supervisor meeting, right? I think going to people at the exact time with specific ask is always super important. Relevance, as I mentioned, having data that is not 10 years old, but data that is somewhat relevant and as close to the date as possible, just so it gives an understanding of where we are with a particular issue. The last piece, which I think is often the most important, is the follow-up. We have our meetings, right? We have the phone calls, we have the Zooms, but then what? Making sure that you're working with a staff member, with a legislature, to make sure that they're actually following through with whatever it is that they promised. So that's very quickly many tips in a nutshell. But first, I actually want to turn to you first, Christy, and then go over to Ryan. As we think about this topic of building presence with legislatures and policymakers, I wonder if you can share a success story in your work, because maybe that can help illustrate other tips you may have for people as they do this work.
Yeah, it was really interesting. And I'm just so inspired by everyone who spoke before. So I just want to acknowledge that too. But, one of the things that I recall just in previous was so many partnership opportunities. And one was honestly around when we were doing the expansion of Medi-Cal for those that were 50 and over, and really helping to partner with with our local electeds to understand how we can be a part of that. Many of the folks that fell into that category of 50 and over that all of a sudden now had Medi-Cal coverage, we were already seeing many of those folks. And so helping the legislators understand as all of this is taking place, here's how we can partner. And as you have various agencies that are coming to you, we are a resource, and we can also help with at that time when that was happening. And I anticipate that we're going to have this coming back up as we go to January 1st, and there's even further expansion, is understanding too the culturally competent care. There is a lot of hesitancy that exists still, specifically for folks that are undocumented, and being able to understand what are our policies and procedures that are in place in our clinics that help to protect folks, and that we don't share information. And so those are those opportunities I felt that were just really critical to helping make that a smooth transition. So that's the example that really came to mind. And I also think that it's something that, again, as we're looking here in the next 6 to 8 months, is really going to come up on us again.
Awesome. Yeah, Ryan.
Great, thank you. I'll not to date myself, but back in the one or previous role I had, I want to say back in the late 90s, I think you would all recall there was a lot going around in efforts to reduce tobacco consumption and use. And so one of the key things that I was really involved with the organization I was at the time was it all comes down to really establishing relationships, getting to know these individuals, understanding who they are, what their thoughts are, what they're thinking of, what issues are important to them as well, and then also to their constituents. I think for all intents and purposes, you want to be sort of that resource and become that subject matter expert. And so really, how do you then establish yourself or your organization as that go-to place for that information? And so one of the key things that we worked on quite heavily was, looking at local ordinances, for instance, self-serve display racks or advertisements at a certain height, really about focusing on, working with local city councils to kind of bring about these ordinances to ban those practices locally. And so, using that effort, understanding that where some individuals were that thought about this might be something bad for their cities, and obviously using that sort of as that engagement piece on how we can work together. And then obviously using and mobilizing you to kind of do some of those surveys. So we talked about using local data, using real-time data to kind of help inform those decisions. It's very, very much a key part of making sure that you were able to present on this issue at a city council meeting and try to, kind of gain some sort of traction with individuals to understand this practice is bad. I think, what that really did lead to was, several cities that we worked with ended up creating ordinances that really did ban, either self-serve display racks or advertising of tobacco products between the heights of, 3 feet to about 4 feet. So in that sense, really was about how do we then engage something with local legislators and policymakers? Because I do believe that, local politics is extremely important, and even something smaller on the scale of working with the city council is just as important as anything you might do at a local level, going to a county level, to state, or even at a federal level. So that for me is one of the key success stories that I can recall in a previous life related to how we engage and build presence with legislators as well as with policymakers.
Yeah, no, thank you so much for bringing that up, Ryan, because I think too often many folks think that we have to go to the federal government, right? When decisions at the local level are actually more immediate, more important. And I love what the both of you said, because oftentimes things get done when people are informed. I think too often in our politics, it's like, oh, like they don't care. It may be the honest thing where they just don't know. And it's organizations like the both of you that are there to offer that partnership to help inform, to move policy, right? Al, I want to turn it to you next. Given the position that you have in Orange County, kind of like a two-part question, but I'm curious, how do you sort the many requests that come your way and to the supervisor? How do you prioritize what the supervisor addresses, and more specifically, thinking about the work of Christy and Ryan, how can individual health centers uplift their issues with you in your office?
So for our office, we basically looked at what the supervisor's priorities are. His priorities are pretty much homelessness, health equity, housing. So when issues come to us, we try to kind of make sure that those are pushed up to the top, and supervisor usually likes to meet with folks who bring issues or bring opportunities to change policies. So we kind of prioritize those to have conversations with them. And then our staff take meetings too. Our staff take meetings in terms of, any issues that are a priority for the supervisor. But when it comes to, there are folks who actually lobby on a regular basis for items that come up on the agenda. So most often our staff take those meetings so that they can be filled, and then they brief the supervisor on it. I think for organizations like the coalition, it's very important to build that relationship. I think Ryan mentioned it. We having that early and often meeting with folks, and that might be with the supervisor, but that might be with the health policy advisor. In my case, I'm the health policy advisor for the supervisor as well. So you will be meeting with a staff member who actually has access to the supervisor. I think COVID was a prime example where we had a lot of community-based organizations, especially the coalition. Our office worked with the coalition on a regular basis, primarily because of the expertise that you brought to the table. We ended up, always tapping into, I would always call Isabel and say, like, when can we have the next clinic, right? So those type of relationships, once you build it, it's very important, and it works both ways. We will tap into your relationship, but then when there are opportunities that needs to be heard or issues that need to be heard, you have easy access to us as well. So.
Yeah, no, and I love what you also said too, Al, because that the relationship piece is very crucial, right? And I think when we look back over the last couple of years with the pandemic, I assume the supervisor can't fulfill his own objectives for his community without the help of Ryan and Christy, and then vice versa, right? Making sure that they serve their folks without the assistance of the supervisor in your office, right? So I think the relationship piece is just absolutely critical. Turning it back to Christy and Ryan, one of the questions we were thinking about, you serve hundreds of thousands of people. I think nearly half a million. When we think about health disparities now in this post-COVID-19 context, and the impact of policies and systems on the people that you serve, I'm curious what each of you think about the role of civic engagement is in all this, whether it's the usual protest or voter mobilization efforts. How do you think about that in terms of advancing the policies that you want to see changed in your community? Christy, yeah.
You want me to go?
Sure.
Well, I mean, I think that health centers in general, in communities and nationwide, we always think of ourselves as really being the voice of those who don't have a voice, right? And in many ways, beyond kind of, we can talk about that in regards to women's health right now, and we can talk about it in regards to, immigration and those types of things. I think what is always important is for us to be able to look at the needs of our population and what the barriers are, and be able to help those that we're working with, again, on a national, state, local level, to be able to understand that perspective from our lens, and being able to, kind of share the needs. There's lots of perceptions, and oftentimes those perceptions of who we serve in our community health centers or what's happening in the community is not completely reflective of the entire scope, if that makes sense. And so I think we have a great opportunity and in many ways responsibility to be bringing stories forward. Stories are incredibly powerful. And I also think that there are a lot of stories, I think of homeless individuals in particular. There is when people talk about folks that are experiencing homelessness, there is an image that they have. It's the people who are on the streets who are pandering and those types of things. And we all know that it's so much bigger than that, that we have, kids and families that are living in their cars or, sleeping on floors and those types of things. And we have those stories again that we can share. So.
Awesome. Ryan?
Thank you for that question. I think this is something that has been an issue or something that I've cared very deeply and been very deeply passionate about, only because you think about how things actually play out in policy as well as, for instance, in elections. And you talk about the idea around mobilization of patients and providers for that matter. And I want to group providers as a very loose term in the sense that I think everybody that works in our community health centers, regardless if you are the receptionist or doing intake or even an MA, you deeply touch each of these individual patients. And with that, you become an advocate, not only for yourself, but also for these individuals that are seeking care at your site. So it doesn't always have to be a physician or a doctor or someone at that level. It can be anybody that actually has this touch point with these patients and has a chance, I think, to be one, educated and also to be informed, and then also to help educate patients as well that may be seeking their advice. And so that being said, if you look at how the last election played out, and many individuals that were elected to office may have only won by 3,000 or 4,000 votes. So if you think about from that perspective, and we have close to 350,000 to 400,000 patients that come to our health centers in our county, how many people do I need to mobilize to vote a certain way that can swing an entire election? It's not rocket science. It comes down to numbers. And so if you think about that perspective, I think it is also understanding that each individual has a role to play in this space around engagement of our communities and actually empowering our communities to make sure their voice is heard. Now, that being said, I think having individuals understand that they have a role in this, that they play a part, that they can influence or they can educate, I think is the first step that we need to really engage in our communities and really work with individuals to help them understand what sort of power that you may have and not realize that you have as we engage in this process moving forward. Again, like I said, there are, I think, many opportunities where we can have many touch points with many of our patients. And yet, I think that also has to be something that our providers and patients need to be aware of, that they can become advocates in this space and can actually help spread that message and sort of create that change that they really want to see in their communities.
No, that's awesome. Yeah, thank you for mentioning that. At our foundation, we're big proponents of everybody just, vocalizing however they see fit the issues of their community. I'll turn it to you before we ask any audience questions. Just as a follow-up of that, obviously the supervisor wanted to do public service to serve the public. And, as I think about this question in relation to the supervisor and the work that you all do, what is most helpful in terms of, you have so many different actors, you have patients, you have the centers themselves, the doctors, like whoever. I'm just thinking about how you think all of those pieces can work together and communicate one policy agenda that would better help the supervisor actually get things done and move the needle on health issues in the county. I think you're on mute, Al.
I do that all the time. So I think part of it is to make sure that we build that coalition, right? We're in the process of having the conversations with elected officials. It's great to have organizations like you bring in patients who have stories, especially if you are advocating for a certain initiative to be passed. Then not only bringing them in front of a supervisor and having to talk about their story, but also talking about why the absence of A, B, or C is affecting their life, and thousands of patients like them, it's a powerful picture. For me, I always love to paint that picture in front, because once you paint that picture, it's hard for you to kind of turn away from it, right? Even if you're in a tough situation in terms of a vote, if you paint that picture, it's hard for you to say no to that person. And then the other part is holding them accountable, because I think one of us mentioned about it in the prior session, where once you have these conversations, it's very important to follow up and follow through, because most often we paint that picture and then we're gone. We do that 15-minute meeting and then we're gone, and we don't do that follow-up. I've taken so many meetings with folks who have that meeting with me, but I don't hear about them until the next issue comes up. It doesn't really help to say that it's a burning issue in front, right? So having that, plus on top of it, to make sure that our communities are involved at the grassroots level. What we often put is folks who are activists or who actually represent organizations who come in and speak. But mobilizing the grassroots and getting them out to speak at supervisor meetings or speak at council meetings, or even coming in droves to meet them at one of their events, that helps to say that there is this issue which is burning and we need you to pay attention, right? So I mean, I also go back to the grassroots level of organizing. I think it's important for us to make sure that folks who come to the table are given information, because more often what I see is people just kind of parrot out the talking points which are there, but tell them to speak from their heart, their stories, which are authentic. That resonates better than a couple of talking points in front of them.
Yeah, no, that's an excellent point, because anybody can write talking points, right? But when you speak from the heart, it actually can help move people and their hearts and minds. We have time for one quick question. And forgive me, this might seem like a loaded one, but someone in the chat asked around issues in the city of Anaheim during the recent election, how elected officials had competing priorities that seemed to nullify data or persuasion tactics. I think the question is, and for anyone that wants to answer, how have you all overcome these barriers when competing interests kind of seem to have like a financial advantage that seem to nullify data-driven campaigns? Christy, I see you're shaking your head. Maybe you would want to address that.
I don't know if I do. No, I'm kidding. I'm reflecting because we've had a recent situation in Santa Ana where we were trying to move something forward, and there were competing perspectives and priorities that were in play. One of which was that we have a couple of the city council members, city council members that are in the process of potentially being recalled. And so in that situation, then we had someone who believed in us and what we were trying to move forward, but were hesitant in stepping in to take a stand because the concern of public perception. And having worked in county government myself and in different scenarios, I understand that, and it does make it really challenging. So I don't know that I have a better answer, Ryan. I'm going to kind of flip it to you to see if you have some, probably better answer.
The only thing I can think of is, from an advocate standpoint, is that I think even within multitudes of different groups that you may collaborate with, and I would say even using our coalition as one, we have 27 member health centers, and there are often times when we each have different agendas and we each have different perspectives on things. I think part of the issue that you have to address is, understanding that everybody has not necessarily their own agenda, but they only have their own perceptions and their own thoughts and their own feelings about certain things. And so from that is really just about having a discussion with those individuals and having really a great discussion about, what are those differences? How can we come together? And sometimes there's always, I think, a point of, when we also understand that we are all leaders and then we're also all followers. And it's really about sort of that dance and understanding when you step in and when you step out. I think partially the issue is there are always going to be times when people will have differing opinions, such as your own. I think only through dialogue can you really understand and be able to see another person's perceptions or their own perspective. So then maybe there might be more that you have in common in the end than you really do at the beginning. And so I just kind of structure from that perspective of, understanding how we ourselves would kind of address that, going through the whole process of understanding, and coming to consensus about certain issues. I think that also applies, on the bigger scale, as you mentioned about certain candidates feeling a certain way. I think they're always trying to create their own agenda, but from an advocate standpoint, I look at it as how we come together and how we can have that discussion, and we should have that discussion.
No, thank you. And now I'm going to ask a follow-up of that and I'm going to ask it in a way because, let's say the coalition comes to the supervisor is sold, but how can advocates help the supervisor kind of build a coalition where he sits at the board of supervisor level? Because I'm sure there's many discussions with other supervisors and helping the supervisor kind of bring his colleagues to help address many of the issues that the advocates want to see at the supervisor level.
So you got to understand the politics of it, right? The nuts and bolts of it. So basically, board of supervisor, you have 5 board members, and as a supervisor chief, he could only speak to one other supervisor about an issue, because if not, he'll be breaking the Brown Act, right? So basically, for us, the way we do it is we work with one supervisor to bring in an initiative, but then we move around and ask community members to kind of talk about the issue with others. We have a couple of initiatives coming up. We're in the form of, we've already met with some of the CBOs to talk about that issue, but we also mentioned that we're going to be introducing it, but now it's important for them to take that message and talk with others, right? So in essence, we can lead the way, but we can't tell them, or we can't go out and have more conversations with more than one person. So that leadership needs to be taken by CBOs on the outside and coalesce, bring folks and have conversations with different supervisors to bring that third vote, so to speak, to pass that initiative. And that's a little bit of it depends on city council, depends on if it's 6 or 7. You got to play the numbers, right? When you talk about state legislators, that's even a bigger number you're talking about. So understanding the process and making sure that you organize accordingly around the issue that you bring up is very important. I know that we had our supervisor introduce the Declaration of Racism and Inequity as a public health issue. When that came up, we had put out the call to some of the CBOs to say, like, look, come out and make public comments, right? And have that conversation in public, or if you can't meet with supervisors, but at least be there on Tuesday to make public comments on it. So that's the way that our office could do the work, but that's where we also look for partnership outside of the office from organizations like you.
Awesome. Thank you so much, Al. And so we are just at time. So once again, I want to thank Ryan, Christy, Al for this terrific conversation. I even learned a lot. I feel like I should do more advocacy work in Orange County, but our time here is done. And so Ryan, I think I'm handing it back to you to close out this great event. And thank you again, everybody.
Thank you.
Thank you, Christian, for that invigorating discussion about deepening our relationships with each other and building presence with key stakeholders in our community. Christy, now thank you again for diving into some critical discussion questions and sharing your insights that you've learned and have participated in the past. So as we close out our first Coffee Connections event for this year, I want to take a moment to summarize some of those key insights that we heard today. So as you recall, Isabel welcomed us this morning and reminded us of the importance of reconnecting to our why. The work that we do as individuals, as health delivery systems, elected officials, public health professionals, social service providers, and many more to address health disparities and enhance community health to create a healthier Orange County can often be taxing. From navigating complex systems to addressing root causes such as structural and social determinants of health that impact our communities, to advocating for more funding, for policy change, etc. All we do is driven by passion and the heart that we sometimes can feel a bit overwhelming. So as Isabel reminded us, It is important to keep yourself grounded, to keep yourself at your center, to keep your why and our collective why at the forefront of what we do. Supervisor Sarmiento also opened up in our event with a reminder of the importance of relationships. Whether it's building new relationships or deepening existing ones, Supervisor Sarmiento brought to the forefront the importance of this partnership and collaboration on our journey to create a healthier Orange County. I believe it's through these partnerships and collaboration where we can listen, learn, and work together to create change. During our Advocacy and Civic Engagement 101 session, we learned the importance of having shared language and common understanding, as well as in the importance of sharing our stories with each other as a tool to create change. As it was shared during the session, advocacy and civic engagement aren't additional things that organizations need to do, but really they're tools that allow us to better address the pain points that our systems and communities experience, ultimately leading to the reduction in health disparities and creating healthier communities. It's about shifting our mindset, identifying tools that can allow us to do our work even better. For example, Dr. Shapiro talked about the use of social media in this effort. He also shared with us our communities and our community's moments. He reminded us that magic occurs outside the four walls of healthcare delivery systems and the importance of focusing on social and structural determinants of health. So let's get out there, not only to inform ourselves, but others as well, share the information and our stories through social media outlets, and let's get out there so we can be part of the fight to make things better for our future generation. During the advocacy and action session, leaders from Ultimate stressed the importance of embedding the concepts and principles into the organization's strategic plan. Civic engagement is a catalyst for systemic change, and as such, executive leadership buy-in is critical to intentionally creating those systems and processes to embed both advocacy and civic engagement into the culture of an organization and also into the mindset of community health centers and their leaders. As Rolando shared, we have a responsibility and must continue to uplift community and work hand in hand to make systemic change. Patients equals community, and as community health centers, we have the ability to harness collective power. And as a reminder, don't forget to check out myhealth.org for additional information. And then lastly, as we just learned during the building presence session, the key to building presence is persistence and consistency, staying informed, timeliness, relevance, and follow-up. I think the importance of relationships and keeping each other informed is how we get things done when people are informed. Additionally, relationships are bi-directional, right? It's a give and take. As I said before, it's just also ensuring you're able to also hear the individual that you're working with. Community partners can tap into legislators as well, as legislators can tap into community partners, and that really just start with deepening relationships. Again, as I said, it's really about also becoming that sort of subject matter expert, being that go-to for information that you want to establish for yourself and your organization. The importance of painting a picture and holding each other accountable. Once conversations are important to follow up and follow through, very, very important. And then throughout all the conversations today, we're reminded that stories are important. And although it's vulnerable to share these stories, they are also very powerful in making change. Again, we want to thank all of our amazing speakers today. Thank you for providing us with a great insight and action steps. Thank you to all the attendees for joining us today. We hope that you had such a lot of fun as much as we did. We will be dropping into the chat a participant survey, and we do want to appreciate you providing us with any feedback to help us continue to improve. And as a reminder, we will have 3 more coffee connections that are upcoming this year. They are slated for June 30th, September 29th, and December 8th. All the coffee connections will be held from 9:30 to 11 with topics to follow. In closing, if you are interested in sponsoring coffee connections, we'll also put that link in the chat as well. Again, I really wanted to follow up and make sure you filled the participant survey. Also really want to again thank our speakers, and hope you all have a great weekend. And before you start, just want to leave you with one thought. What is your why?